To answer this, I'm going to go over my 12 tips to get started with veneers. Tip number 1, invest in your education. When we talked about my journey, I told you about how much I've invested in CE over the years. So the first step is going to be invest in yourself. You have to be willing to spend money to make money. You have to be willing to maybe invest in higher end CE courses to get started. It's like your education for cosmetic dentistry begins after dental school. So think of it as an extension of your dental school training. Tip number 2, improve your clinical confidence and master your skills. I found that there's 4 main things to gain clinical confidence. Number 1, learning about the process. Number 2, watching the process. Number 3, actually performing the process over and over. And number 4, how to recover when things don't go as planned. These are all vital for your success and confidence. In order to become successful at veneer cases, you have to put in the hours. You have to work on developing your eye for detail and learn what's possible with someone's smile. Use my guidelines to start having conversations with your patients. You can even start practicing wax ups on teeth models or start practicing veneer preparations on teeth models. Number 3, treatment planning and diagnostic abilities. Part of the learning process is to see and plan as many cases as you can. Not all cases are the same, and each patient is unique and individual in their goals, needs, and expectations. You have to learn how to narrow down your recommendations to your patients. Work on developing your eye for cosmetic dentistry. Number 4, speed and efficiency. Improving your speed and efficiency are important as well. No one likes to be in the dental chair. You have to put in the hours and time working and practicing to become proficient. There are no shortcuts. Learn the systems and protocols to do veneer cases quickly and efficiently. Know how to get from point A to point B in all of your cases by following consistent steps. Tip number 5, patient, lab, and team communication. Being able to focus on the needs and goals of your patients is important to your success. Being able to communicate to your patients, team, and lab is vital. The most important part of communication is actually being able to listen to your patient and being present for them. Tip number 6, cosmetic dental lab partnership. There's no way to do excellent veneers without using a high-end cosmetic dental lab. Pay the higher fees. It will save you headaches and remakes. Start working with a great lab early in your career. I've learned so much from my lab ceramist over the years that information is priceless. Tip number 7, progress from a few teeth to full mouth over time. Dental school prepares you for single tooth dentistry, but to become a cosmetic dentist, you have to understand full mouth concepts and be able to perform full mouth treatment plans and complete comprehensive care. A smile makeover with veneers can consist of 8 to 10 upper teeth. You have to learn the mindset and understand the sequence of steps in order to be efficient with your chair time. Start small by doing 2-unit or 4-unit veneer cases. Then move up to 8-unit veneer cases, then 10-unit veneer cases. Get comfortable with each step before moving on to the next. Tip number 8, get good at photography, build your portfolio, and show them what's possible. Showing patients the smiles you've transformed and documenting your work is another important concept. Document and take pictures of everything. Build your portfolio of your veneer cases. Review your own before and after pictures of your cases. This is like an athlete watching footage and replays of their game. See where you can improve. Use photography as a learning tool for yourself and for your patients. Get comfortable using a high-quality digital camera, and just as important is to learn good lighting techniques. If you don't have as many cases to show your patients, take good quality pre-op pics of their teeth and smile close up. Upload to an iPad and use Markup or Procreate to draw the changes you could make to their smile on the screen. You can also look into an imaging company or an app to image a patient's smile to give them an idea of the changes you can make. Tip number 9, smile design. Being able to communicate the changes that you can make to a smile with veneers is important. Understanding smile design and how the teeth and facial features are related is vital. Also, understanding soft tissue aesthetics will enhance your results. You have to be able to think about the patient's end goal and your end goal for completing their treatment and how to deliver predictable results. Knowing how size, shape, and color all affect the outcome is important. Refer back to the guidelines in this training to help. Tip number 10, patient comfort. Doing veneers and working on multiple teeth simultaneously means longer procedures for the patient. Understanding patient comfort is a priority. Local anesthesia principles and sedation dentistry protocols are helpful for smoother appointments. As mentioned above, no one likes being in the dental chair. Learn how to make patients comfortable during longer procedures and learn how to be efficient with your time. Tip number 11, market yourself on social media. Even if you don't feel confident in your skill level yet, you have to put your work out there and use social media to get people's attention. Because the more you can put out there, the greater chances you have that someone who wants veneers will want to use you to do their veneers because they've seen your content over time. Without fail, every time we post a before and after smile photo, we get several lead inquiries about people wanting veneers. So work to start sharing your work and personality. In my courses, I talk about how to share videos and content effectively in order to increase your following and viewership. Tip number 12, offer marketing discounts when you're getting started. An extra 5 to 10 to 20% can help patients say yes to treatment, especially if they're trying to fit veneers within a certain budget. There's many times where a patient could only afford 6 veneers and needed 10 veneers to get the best result, and we would help them with a discount. So we would offer the patients a marketing discount. In return, we would ask them to be open to sharing their journey, their before and afters, and letting us document the process. This ultimately helps us market ourselves and build our portfolio because we're gaining more content. So there you have it, my 12 tips to get started doing more veneers.